Okay. Yeah, I just
Hello. 挥手借支笔吧，借支笔，有没有 ？You have an extra pen? Yeah, 谢谢。Thank you. 等一下还你。What do you guys want to know? I already prepared my lecture. What do you guys want to know? Anything? Okay.可以吗? Is that clear?
Yeah, pretty good.
Oh, pretty good.
maybe like
Mm-hmm.
like what to look out for.
Okay.
Clinic and at school.
Clearly at school.
Because in Santa Cruz, no one wears masks, but everyone here wears masks, and maybe just your opinion on what is the best thing to do.
Okay.
Repeat it back.
This is the slides I created for my own clinic. Okay, so I post this in the clinic. First of all, every patient that enter into the clinic have to ask, have they ever been travel into China, Korea, Japan, Italy in the last 14 days before they're sick? That's a very important question you have to ask everybody. And then second, if they have ever have a fever or a cough or shortness of breath symptoms. So if any of the symptoms are valid, so I'll ask my staff to give them a mask. Okay, why I do so? Because a surgical mask can help prevent a patient with symptoms from spreading virus, okay, by containing their cough and sneeze droplets. But a surgical mask will not prevent you from getting coronavirus. Means that if the droplet is everywhere in the air, you know, it doesn't matter. you will get it. But those people will actually wear, if they are coughing, they have to wear a mask. So this is the most important things that we have to tell our patient. If they walk into your clinic or in the clinic in our school, they are presenting with cough, fever, they are not wearing a mask. It's our obligation to even give them a mask. I know that nowadays there's not many masks available, but I prepare some masks. It's actually not for myself, it's for the patient who are coughing. Okay. And in the entrance of my clinic, everyone who enter into the clinic have to use alcohol pads to clean their hands. Okay, before they touch anything or before they sign in. So if you guys are interested, or if you're already a practitioner, and then I'll be willing to share these slides with you guys, and then you can print it out. Okay. So that's some of the questions that we may not cover in the lecture. Okay. Yeah. Any other things that you wanted to ask? Maybe later we have a such section of a question and answer, and I'll further answer more questions that you guys have. Okay. I'll keep this open, so I'll switch to that. Okay. So many research found the coronavirus is sensitive, and it's actually the structure can be destroyed by alcohol. Okay, 75% or 70 to 70% of alcohol can destroy the structure of coronavirus. So having a hand sanitizer that with alcohol is better than the ones without alcohol in it. And then constantly spreading the alcohol on the surface of the clinic is also is mandatory, Mm-hmm. Are we started or not yet? We can start? Okay. So many of you already heard about the outbreak of the coronavirus, and today is actually an introductory class that we offered in 5 branches with the students in the lunchtime. And I do believe there will be further classes that offer in our school to tell in detail and how, as a TCM practitioners, that we can help this kind of epidemic condition. Actually, according to the news released in China, there's actually 75% of the patients is already, the Chinese medicine already involved with the prevention and also treatment of the coronavirus outbreak. And outside of Wuhan, actually is 90% of the people are using traditional Chinese medicine. So this disease is actually caused by SARS-CoV-2 virus, and it's called COVID-19. And COVID-19 may actually take up to 14 days to appear after exposure to the virus. So it's actually, this is the longest no infection period for this virus. And then this is the picture that actually took from the Johns Hopkins webpage, and currently until now, March 2nd, 7:43 a.m. today, there's already 89,000 people affected by confirmed cases, and majority of the cases are in mainland China. And you start seeing the South Korea start to, catching up very rapidly. Now I have 4,300 cases in South Korea, and also 694 in Italy. So And out of all these cases, actually there's 55,000 people are already recovered from the coronavirus, and those 3,000 people are dead. The death rate is kind of pretty low. And then we're going to go to detail in the later slides. And so it's already almost like a pandemic instead of an epidemic. So this particular COVID-19, the signs and symptoms are actually very interesting because, first of all, actually only 43% of the people presented with fever. But lots of the people actually don't have fever, but in the very early stages, they already have CT abnormality. And I'm going to talk about this a little bit later. And they presented with dry cough and extremely fatigue. Okay, these three major symptoms actually have a very high percentage rate that people are with coronavirus. And then one more thing that you have to pay attention is that they actually have an absence of upper respiratory tract symptoms, including running nose, stuffy nose, sneezing, sore throat. So they don't have this upper respiratory symptoms, but then they do have diarrhea and low appetite. And then in very early stage, they already start showing shortness of breath. And then in the Chinese perspective, Chinese medicine perspective, they have actually presented with grazy and white tongue. And of course, asymptomatic means that the patient have no symptoms, can have a very abnormal CT scan in the very early stage. Okay, so here is actually one of the papers released in JAMA. Okay, and the findings for the people who are actually affected by coronavirus, there's 138 cases in this study. There's the fevers in the hospital. This is in the hospital already, okay? Fever is about 98%, and then there's 69% of the patient have fatigue and dry cough. Means that there's no mucus, dry cough. And from first symptoms to shortness of breath, dyspnea is only 5 days, okay? And from first symptoms to hospital admission, 7 days, and from the first symptoms to acute respiratory distress syndrome, okay, it's about 8 days. So it's very rapidly, developed. If you didn't treat and involved, in early treatments, it's going to kind of happen very rapidly. So about 81% of the patient actually have a negative, PCR result, which is the testers, okay, but a positive CT scan. So this is actually people like you can test as a negative and then rapidly develop the symptoms like a coronavirus pneumonia, and then you later test as positive. So in China, they already started to using CT scan as one of the major screening tests for people who are having symptoms like coronavirus infections. And here it says the interval between the initial negative to positive PCR results was 4 to 8 days. So after 4 to 8 days, even though you have a negative, PCR test, and eventually it turns into a positive. But in the 4 days before 4 days prior to that, you already have an abnormal CT scan. So CT scans will be a very major diagnostic tools that in China. So here it says the CT provides the best diagnosis for COVID-19, and then one of the characteristic of them is actually 98% of the cases showing bilateral involvement. So both lung get affected. 77% actually are shown as a pure ground glass opacities, and I'll show later in the slides. And 75% are interstitial and interlobular septal thickenings, and 59% also have a consolidation. So this is some of the CTs that I actually got it from the radiology magazine, okay? And then you can see this is a bilateral infections. And then And then there's one very significant characteristic of the COVID-19 is that the infection area is posterior and peripheral. See, posterior of the lung and peripheral on the edge of the lung. So if you see patients presented with this kind of CT, even though the test is negative, you almost can diagnose this patient that this patient presented with COVID-19. Okay, so another, peripheral, posterior, right? Posterior, peripheral, and with ground glass opacity. In the very and then here this is only 44 years old, and we give them a name. This kind of lung is called big white lung. Okay, if in the traditional Chinese medicine perspective, this is actually a very early stage. You have dampness and the fluid, dampness symptoms in the early stage. So coronavirus, the fatality rates are very widely depending on age, gender, and also medical histories. This is the report I got from JAMA, and then the paper is reported 72,000 cases, which is a pretty large and paper that's presented. Here it says that confirmed cases are 44,000 and suspected cases are 16,000. Diagnosis cases are 10,000. Why there is a different cases called confirmed, suspected, or diagnosis? Because remember we're talking about if it's positive on the CPR test, it might show negative at the beginning. So if you are confirmed, means that you have to have positive, viral nucleic acid test. And then suspicious means the diagnosis based on the symptoms, exposure means that they went to Wuhan or they were contacting with people from Wuhan. And then the diagnosis one are the ones that already have the presenting, because in Wuhan it's actually break out very suddenly. There's a lacking of testers and people that actually can go through like so many thousands of people a day. So that's why, and then look at this, asymptomatic cases are 889. Okay, age distribution out of the 44,000, okay, confirmed cases, not suspicious, okay, confirmed cases. These are 80 years old are about 3%. 30 years to 79 years old is about 87%. Okay, 20 to 29 is 8%, 10 to 19 is 1%, and less than 10 years old is 1%. So you can see that this coronavirus usually attack people during is above 30 years old. Okay, and mild cases actually are 81%. So majority of the patients are mild. And severe cases are about 14%. Criticals only 5% of them. So we're talking about critical is people already have like multiple organ function failure or dysfunction. Okay, so this is the case of a fatality rate is 2.3 among all the 44,000 confirmed cases. And 14% of the patients actually greater than 80 years old. 8% of the patients are in the range of 70 to 79, and 49 cases are in critical cases. So if you have this data actually showed us if you have elderly, in your families, they are actually about 70 years old and above, you have to be precautious. Or if you have patients that fall into this age range, then you also need to pay attention. Okay. We're talking about this very important part is the healthcare personnel infections infected. Those is about 3.8% and already 5 deaths. 63% of them are in Wuhan. So looking at this data, and we had to think about us, unless, we are very sure that we're confirmed with the symptoms of the following that we're going to mention later, and then do not go to hospital immediately. Maybe you just have a common cold. The risk of that is that if you have a common cold and you may not have coronavirus, and then in San Jose, in the South Bay, and actually we're already in the stage of a community transmission, means that the coronavirus is probably with us, okay? And then if you enter into the hospital, then people there may already have coronavirus, and you may not, and then you will have a secondary infection. And that's why in Wuhan started to become such a serious cases, and the thousands and thousands of people get infected because of that. So TCM diagnosis. So first of all, if we're talking about the coronavirus, people have fever, or maybe without fever, then there is a heat presents, right? And big white lung. Okay, it means that the patient's the CT shows the ground glass opacity, diarrhea, gray skin and white tongue, heaviness in their body and joints. That actually is the indication of dampness in the body. And extremely fatigue, lethargic, shortness of breath is also an indication of qi deficiency. So if you look at the heat, dampness, and qi deficiency, then we know that, how we're going to help our patients or prevent the patients to enter into a condition that are easy to get, coronavirus. You know that in traditional Chinese medicine, we're focusing on prevention and also early intervention that will actually help the patient to not enter into severe or critical condition. First of all, this is some of the tongues that I actually get from some of my colleagues in China. And then those are the patients are suspicious and confirmed, or maybe they still have fever. You can look at the tongue, okay, very white. It's almost like the CT scan that shows in the in the coronavirus patient. And then with what? Teeth mark. Okay, there's later. And also, there's some of the tongues are actually not very red, but some of the tongues already shows purple colors, means stagnations and blood stasis in early stages. We know that the ground glass opacities, and the consolidations in the CT scans that we show, right? It's actually our pus. It could be pus, blood stasis, phlegm, or interstitial fluid that occupies in the lung. So if that's the presentations, then in traditional Chinese medicines, how we going to deal with the patient with this condition, we have to take care moving their blood, right? Drain and the dampness, removing the phlegm, and also clear heat. This heat may not present in the early stage, it comes actually later. Why? Because the lungs get stagnated, the internal heat start to build up. Okay, so early interventions will help the body to alleviate the symptoms and prevent the patients to getting worse, right? And this is another patient, and then we can see the progression of the tongue, which I don't have the full spectrum of it, but you can see very white coating, okay, and what? Teeth mark. With teeth mark is qi deficiency, and then the white coating is dampness and phlegm. This is the tongue that actually I get it from my clinic on Saturdays. There's a couple patients that are presented with no fever, but dry cough and fatigue. Okay, and of course they were not coming to the clinics to see the symptoms, but they actually start showing the tongue with white coating. So, and then this is one, and this is another one. Okay, the tongue wasn't look like this before, and then it starts showing this kind of presentations in the clinic. So, and then on top of that, we can actually add some treatments, that acupuncture points that help to remove the dampness for the body. And later, we're going to also talk about this and what points you should use for patients presented with this tongue in our clinic. Okay, so there's actually already 4 versions of a government guidelines that's being published in China. Inside the guideline protocols, including the traditional Chinese medicine, and the herbal distributions to the patients who are in 5 different stages. So I decided to use the one that published in Zhejiang, because in Zhejiang province, they actually consider, they also consider and take a look at the government guidelines, and together with the modifications of the local Zhejiang province weather. Okay, of course, in U.S. we have our own. We also have our own, weather characteristic. So I don't want to give you the formula and not having modifications. So all the practitioners in U.S. we should modify according to the weather, and in our local area, to further helping the patient to alleviate their symptoms. So look at this report that coming from the Johns Hopkins, Zhejiang, mainland China's. The reason why I choose this, I was looking at the data. This confirmed cases is 1,206, and look at their recovery rate, 1,069. So it's about 88% of recovery. And then existing only 136 cases left, and only 1 death is reported. So, and then the involvement of traditional Chinese medicine is 90% above. So, that's why I decided to use the Zhejiang one, and then I'm going to introduce from the. This is they call red head documents that being releases. So every hospital that receiving patients will have to use this protocol. First of all, they actually separate into diseases. In 5 stages. The first actually is prevention. Okay. And the prevention is actually in the philosophy of traditional Chinese medicines, means we actually take before the attacks, or prevent before it happens, right? Then what the recommendations from this particular guideline is they use 玉屏风散. Okay. 玉屏风散, look at this formula. We have 黄芪 to tonify the qi. Remember that the patients actually present with severe fatigue, and also may not present with fever. And then patients actually have dry cough, means a shortness of breath. It's all like a qi deficiency. So patients we are already embedded with qi deficiency are not having enough sleep, which is very common in the Silicon Valley. They will have a higher risk, to get, contaminated with the coronavirus. So for this, we actually need to prevent before it happens. So you have 防风, right, to prevent the wind, or to expel the wind attack. And we also have 白术 inside the 玉屏风散. So 白术 is also strengthen the digestion system, because many patients with the coronavirus, COVID-19, the symptoms is sometimes they have low appetite and also have diarrhea. Okay, and then there are some of the herbs, like for example, they have like 芦根、苏叶. And also 金银花 is to help to alleviate some of the heat syndromes that you might have it presented in the early stages. The patient might have dry cough or dry throat. They can use 金银花. 藿香 is one of the herbs that is being commonly used for this E toxin or epidemic diseases in the 瘟病. So some people may say, okay, maybe we can also use 藿香正气散. Yes, 藿香正气散 is one of the recommendation only if they have a lot of stomach discomfort or diarrhea. But remember that this time when the coronavirus, people usually don't have, not many people presented with diarrhea, but they do have patients presented with diarrhea. And very interesting, in these protocols, they actually recommend patients to moxa, stomach 36, REN 12, and REN 6, 10 minutes daily. for prevention. Okay, so for people who actually are in the high risk, they actually can max out themselves for 10 minutes a day, and on these 3 particular points. So for our school clinic, we also can recommend patients to max out their home, or maybe we also can include this moxibustion treatments for all the patients that presented in our clinic. Mild cases is actually called means 疫病, is an epidemic disease. So E toxin attacked the lung, and it just started. Symptoms you may be presented with fever or without fever, dry cough, throat pain, dry throat. And this cough usually have very scanty mucus, fatigue, or having diarrhea. So for the formula they recommended for this guideline is a 经防败毒散 modification. Okay. So for people in U.S., either we can distribute the 经防败毒散, or if you have the herbal, pharmacist in your clinic, so this is the following the herbs that you can distribute is 境界 10 gram, 防风 10 gram, 青蒿 10 gram, okay, 苏叶 10 gram, 苍竹 陈皮 厚朴. This is all herbs that helps to alleviate the greasy coating. And here it also have the herbs that actually, for example, 黄连, it's also help to improve the middle jaw dampness. I think I will also releases the translations on the website later for students to download. Then you don't need to copy down this formula. For patients who actually have high fever, okay, they can actually add 青蒿 into it. And greasy and thick tongue coatings, they use 佩兰, 荷叶, 15 gram. Severe cough, you can add 桔梗 10 gram and 枇杷叶. That those herbs that actually can clear heat also, and they help to alleviate the heat in the lung. Diarrhea, you can add 黄连 3 gram. Intestinal discomfort is actually, you can add 佛手 12 grams and 神曲 15 grams to help the digestion. For severe cases, patients actually present with fever or without fever, but they already have pneumonia. Means the CT scan already confirmed that it's actually have the corona pneumonia. Dry cough or light cough with scanty yellow flame, fatigue, shortness of breath, chest tightness, and chest pain. For these symptoms, those patients, they actually they use 麻杏石甘汤, okay, plus 千金委瑞汤. 千金委瑞汤 is one of the formulas from 金匮要略. 麻杏石甘汤 is from 伤寒论. We know that the 伤寒论 is actually the book is written in the Han Dynasty. And then this book particularly is on the epidemic diseases during that period of time. And throughout the histories, actually, if you go to see the textbook, okay, in the epidemic warm diseases textbook, it shows that in China, we at least from Song Dynasty until now, we have at least 256 episodes of epidemic diseases throughout the history. And back then, there's no Western medicine, okay? And then we only use traditional Chinese herbs and Chinese medicine to prevent diseases and help to fight epidemic diseases. So we're actually very experienced in this aspect. And yeah, I think I'm looking forward to see more data that's being released and after this after this whole thing, and then we can study together, and then we're going to look into it, and hopefully that in the future we will have more chances to help patients for this kind of problems instead of treating only pains and aches in the clinic. Okay, 麻杏石甘汤 is actually inside they have 麻黄. So unfortunately now 麻黄 probably is not available. But 麻黄 is actually one of the best herbs to help to alleviate like cold syndromes, and it actually increase sweating. Sweating actually is a way to open the lung. When the pores are open and the sweat is actually coming out, you actually can get the fluid in your lungs released. Okay, and then look at the CT that we just showed before. Patients actually presented with fluid that accumulated in the posterior side of the lung, right, and the peripheral. Posterior, peripheral, which location? What are the channels that are adjacent to that area? 太阳 UB channel, right? It's a 太阳 UB channel. So if you can actually help, to exert the external syndromes by using 麻黄 to open up, right? We call open up the li, right? To let the qi open for the lung to be able to breathe. Then you can actually release the symptom very fast. Currently, I think last week Wednesday, there's one patient was presented with fever in my clinic, and I used 麻杏石甘汤 plus 小柴胡汤. So the same day evening, the fever was relieved. So it could be very fast, and but of course, in these guidelines, there's 麻黄, 杏仁, 石膏, right? 石膏 was actually one of the herbs that actually can release Yang He syndrome, which people were presented with high fever. 知母,土茯苓 is actually one of the herbs that's very good to drain dampness. Okay, so with the big white lung is actually one of a very good options that if you can use 土茯苓in the early stage. If patients who have high fever also use 青蒿, Gracie, and thick coating with 佩兰 and 荷叶. So this is similar to the previous one. Severe cases. Patients have high fever, fatigue, shortness of breath, difficult in breathing, and then maybe they have to be on, ventilation. Okay, chest tightness, chest pain, palpitation. The tongue is actually already presented with dark red, purple, right? Coating is yellow, thick, and grassy. What is the indication of dark red and purple? Blood stasis. So it means that inside the lung, when we have this kind of inflammation that going in the lung, so the artery were dilated. For more of the antibodies can come, into, the alveoli to kill the virus. And then, but not only, the immunity comes in, the fluid will also comes in. That's how come the patients will start having fluid accumulates in the lung. And then, of course, the water comes in, the blood also comes in. So blood stasis, pus, right? Fluid that accumulates in the lung that we have to really help the patient to alleviate these symptoms. So the formula is actually use 人参败毒散 plus 停利泻肺汤。Okay. For the critical stages, it means the E toxin already collapsed the lung. The patient already have like a respiratory failure. Okay, also like multiple dysfunction of the organs. For those patients, they have to be on ECMO. Okay, with face down, position to help them to breathe. And then even people with actually have ECMO and that kind of situations, they put more pressures into the lung. That will prevent the carbon dioxide exchange. Okay, so those patients will feel very discomfort. They will try to breathe hard in order to get the carbon dioxide out of their body. But they couldn't, they're not successful because they're going to be on ECMO, so they will have to temporarily paralyze the breathing muscles during that period of time. And then you will see, you will imagine there will be more blood stasis, more stagnations that going to happen in the lung. So for these kind of conditions, the patients will actually using IV injections. Okay, with Chinese herbs, they probably will use, and also helping patients to using 生腐汤. Okay, 生腐汤 inside is 生晒生. Okay, means the ginseng that is dry, only air dry. Okay, it's not Korean ginseng, red ginseng. Okay. Red ginseng have heat inside. We only want the qi. So we want dried white ginseng. Plus, 西洋参 is actually American ginseng. American ginseng is actually more on the cooling side, and also it tonifies the yin. For patients who actually went through this condition, they're natural and with high fevers, the yin already being deficient. So we have to use 西洋参 15 grams. And 生晒生 30 grams with 附子 15 grams. Of course, this kind of conditions won't come to our clinic, and but I feel obligated to still share with what they're dealing in China, and then looks like the recovery rate of the critical cases is actually also possible with integrative medicine. There's one hospital called Fangcang 医院. Okay, it's one of the 医院 that one of the hospitals that actually are using integrative medicine. So through the whole course of treatments so far, there's 0% death rate, 0% patients that turns into critical condition. Of course, those hospitals are actually only accepting patients who are in the mild symptoms. But they are made suspicious with COVID-19, or they are confirmed with COVID-19 but with mild symptoms. Okay, and then in the hospitals, everybody is required to do Tai Chi and 八段锦 to exercise to strengthen their lung. Okay, so we have a very short period of time, the lunch time, and I don't want to, spend too much of time. You guys might have classes later. Do you have any questions? And then I do believe that we will have more classes that are going to coming up in 5 branches. And then actually, I believe in the doctoral programs, they also have classes that we're going to further discuss in details about how, and also interpretations of how we're going to help the patients using TCM. And the acupuncture points that I often use in my clinics to help patients who have cough symptoms, I use the He point. He point for lung and the spleen. We know lung and spleen, they are considered as tie-in channels, right? Hand tie-in channels and foot tie-in channels. And then I use the He point. 尺泽 and 阴陵. Spleen, someone can help me. Spleen 9. Lung 5, spleen 9. Yes, lung 5, spleen 9. Okay, this is actually can help patient to move dampness and then control and then help and treat the rebellious qi, means coughing. If patients will actually present with very greasy coatings, okay, I will add Ren 12 plus stomach 40 to further help them to remove dampness. And if you see patients in the clinic already presented with white coatings, you also need to help them to prevent, to remove the white coatings. So then they will have a less risk to get affected. And we know that we are actually treating the person who is sick. We're not treating directly or attacking the virus. Okay? So if you have an upright qi, right, according to what Nei Jing said, then the evil qi cannot attack you. So the Washington Post spoke. What are the things that we can do that actually cost nothing? Being calm. Okay? Why I say being calm? If you research on all the weathers that actually right now, for example, North Korea, Japan, and Iran, and the Milan area in Italy, currently their temperature is about 50 Fahrenheit, 40 to 50 Fahrenheit. So there is a study coming from Germany that coronavirus actually usually can survive much longer in 4 Celsius. 4 Celsius temperature, which is actually the temperatures right now currently where all the countries that are having breakouts. So here in San Jose, our weather is warmer. And this morning we are in our 60s. Yeah, so we should be calm. Okay, we should be calm. If anyone have the symptoms that we just mentioned, then you can give them a what? 防风通圣散 to prepare. If already started having cold symptoms, and you can give what? 玉屏风散 to prevent. 防风通圣散 to start with. Okay. If it's only very mild, I'll recommend for 银翘散. 藿香正气散 is only for patients who have mainly like diarrhea, like those kind of gastrointestinal symptoms. And COVID-19 is an influenza. Of course, right now there's no vaccine for it, but Chinese herbs do help. Do you know there's one of the best way to boost up your immunity? Yes. Sleep before 11. Okay, then your immunity will have the best conditions to prevent you from getting affected. And there's many research papers that already, already shown that sleeping actually will really boost up your immunity. And of course, if you are not sleeping well, if you sleep late, I will highly recommend you to tell those patients trying to sleep early. Okay? Plus 白虎汤 together. Yeah, 人参白虎汤. So 人参 plus 白虎汤. Yeah. Okay. I recently began drinking renshi and cordyceps. I think it's okay if you can really find the real cordyceps. That's my only concern. There's many fake ones. So I would highly recommend you to use, if you're not sure that you get the real cordyceps and renshi, I think 玉屏风散 is actually, because huangqi actually are cheap and is actually very good in tonifying the protective qi. Okay. One slide I already showed a little bit before this, the class just started. And this is the any patient that presented in our clinic, first of all, we have to ask them if they have been travel. Before it's only China, but now we have to include Korea, Japan, Italy, that the past 14 days, if they ever travel to all this region, and then if they have fever, or if they have cough or shortness of breath. So if they do have the symptoms, then give them a mask if they're not wearing the mask. And why I say so is because a surgical mask only can help prevent a patient with symptoms from spreading the virus. We know that if we cough or sneeze, there's a lot of the droplets that are actually floating in the air. And then people actually, if they breathe in, they actually can get affected. Or if they touch, when we sneeze, it's about 2 meters. And then beyond 2 meters, they will land it on the furniture, on the wall, okay, on the surface. And then people who touch it, they may get it. Okay, so if people who are coughing, definitely they have to wear a mask. But as far as us, we don't really need mask. And then we should save those masks for people who are working in the hospital dealing with coronavirus patients. Okay, and hand washing is actually one of the major things we need to do. Okay, wash your hand frequently, and there is actually a very good instructions that in the CDC website, and they show you how to wash your hands. And then I think as a practitioners, we should educate ourselves again how to wash your hands, and also educate our patient how to wash your hands. And then it's recommended to wash your hands about 20 seconds. 20 seconds. Yes, 20 seconds. Yes.
You said the virus is not doing that well in areas where it's warmer.
Yes.
So do you think by summer or maybe before summer, the rate of transmission?
That's a very good question, yes. But I won't be so positive. It really depends on every one of us if we wash our hands, and it will help patients to alleviate their light cold syndromes. And then we also tell everybody who are coughing, sneezing, and to wear mask. Then we work as one team together. Then I believe probably in May it will be will be fully controlled. Okay. That's also what the presidents in China have published. And according to the 5运6气, I think that's about the time. Okay? Any other question? Okay? And then if there's no further questions, one more thing, clean your hands with alcohol pads, because alcohol can destroy the coronavirus. And if you have a hand sanitizer with alcohol inside, that'll be a better choice. And then if there's no further questions, and then today's session will be ended here. And thank you, everybody.